In Mali, the COVID-19 outbreak has been going on for more than 6 months now, and the trajectory of the epidemic is currently declining. During these 6 months, as a Chinese medical worker, it was actually very difficult when we first encountered the epidemic face to face. We wanted to push for treatment, but at the same time, we needed to promote quarantine measures between patients and people who had been in close contact with them. The concept was extremely difficult to encourage, because people overseas were not accepting the idea of quarantine. At the same time, as Chinese, we were very particular about personal protection and disease prevention of everybody. In this case, it was relatively challenging for us to advocate ideas like this. It was only possible for them to take it seriously when the pandemic happened to them directly. During these few months of work, other countries had been operating level 2 hospitals as well. Under the same conditions, the Chinese level 2 hospital was the only one that focused on personal protection and promoted quarantine measures. That's why the epidemic in our area was contained so quickly. We were able to maintain a zero infection rate among medical personnel. This time-proven strategy, through demonstration, proved that China's pandemic control concept and experience, especially the specific operational process and the management of the procedure, are highly recommended and worthy of praise. That's why, after the incident happened, the incident that other hospitals were forced to shut down due to the pandemic, and the infections among medical workers, the Chinese hospital was the only one that continued to fight on the front lines against the pandemic. After all this, the Chinese promoted disease control concepts, epidemic preventions, and management procedures became more acceptable for others.